I'd just like to introduce our first speaker, and we're very pleased to have Nicola Steedman, who's the Deputy Chief Medical Officer for Scotland, who's going to talk on stocktaking and succession towards a new sexual health and BBV strategy for Scotland. Thanks, Nicola.
Morning, everybody. Wow. It's amazing to see so many people in a room in 3 dimensions. Honestly, I've been living in a cupboard for the last 3 years, so it's an absolute pleasure to be here and to be here in person. And I'm so impressed with the turnout as well. So obviously this is an area that is of huge importance, I think, to all of us. For those of you that don't know me, although I'm Deputy CMO by trade now, I'm a sexual health and BBV physician by training. So I'm a bit of a funny public health and GU medicine hybrid. So to say I've got skin in the game when it comes to sexual health and BBVs and drug use would be the understatement, and it's always been a passion of mine and always will. So I have the unenviable task, first thing in the morning, of getting you excited about policy. So anybody in the cheap seats at the back there is going to be tuning off automatically. But I do want to tell you what we're planning. It's not finalised yet, which is the other thing. So there is still an opportunity to input into this. And policy shouldn't be done to you. It should be done with you. And that co-production is genuinely really important to us. I think especially at the moment when we're in a time of constrained resources, we've got to do things right, we've got to do things cleverly. We can't afford to be doing the wrong thing for our patients. So I genuinely do want to get you fired up about policy, because I'm going to come back at the end that policy is power. Policy is what we will be held to in terms of what we deliver for our patients. So my ideal is to produce policy, if we possibly can, that means something to people and that allows people to achieve what they want to for their patients. That is the bottom line. So I am going to get you excited about it, whether you like it or not. And what I want to do today really is just to take you along a bit of the journey in terms of where we are at the moment in terms of sexual health and BBV policy, what is coming next, which is the bit that isn't finalised yet, and also just to set the tone as to where we are, because there are other players in the game at the moment. So even what I'm going to tell you about the new sexual health and BBV strategy is not the only picture, and there are other strategies that you will want to know about, because again, they're power. They will allow you to be able to achieve things for your patients that you wouldn't otherwise be able to. So just as a quick canter through, if we start at the bottom of our journey, for those of us you're old enough to remember, and unfortunately I'm one of those people, we started off with a huge all-encompassing sexual health and BBV framework back as far as 2011, and that was till 2015. And that was the first kind of all singing, all dancing framework that brought together sexual health and bloodborne viruses all under one big umbrella. And that was superseded by Framework 2, The Return. It's a bit like the Speed films. And that continued really along the same path. It was the same all-encompassing, really broad framework. And that was due to be refreshed in 2020. And then, of course, what happened in 2020 was the global pandemic of COVID hit, and everything got blown out the park. But we didn't want to forget about sexual health and BBV services, because one of the things that you'll find as a sexual health and BBV physician is that you tend to get kept in the car park, in the porta cabin, and people don't talk about what you do for a living. My mum tells people that I'm a gynecologist, because that's more socially acceptable in Ireland. And so there is a danger, genuinely, that sexual health and BBVs gets brushed under the carpet. And it's a Cinderella specialty. Our patients don't really get to advocate, because nobody wants to stand up and say, yes, I'm the person who's advocating for genital herpes as a person with lived experience. So we do struggle. And so that's why I am a big champion of making sexual health and BBV such a focus at national level. So sexual health and BBV services, with the advent of the pandemic, could have and did suffer really badly, but we didn't want to just leave it at that. So in 2021, we published a recovery plan for sexual health and BBV services, because we just didn't want them to be forgotten, but we weren't in a position in 2021 to be able to say, right, here's what we want the future to look like. Because at that stage with COVID, I don't know about any of you, but I don't think any of us knew what the future was actually going to look like for anything. And of course, we got to 2022, we're in a different position with the pandemic. Things are becoming slightly more normal, the new normal as we call it. So we needed a new strategy, and that's what we've been working on over the last probably 3 or 4 months. And it's due to be published. When I say imminently, I would say it's likely to be over a period of the next kind of probably 6 weeks maximum until it's published. There is still time to input into it. But I'll give you an idea of what's in it in just a little second. So why should you get excited about this new strategy? What's different? Well, the good news is that it is different, or you may not see this as good news. The first thing is that the timescales for the implementation of this particular strategy are different. So the previous ones were 5 years. This is now 3 years. It's deliberately 3 years because the sector hasn't recovered yet. We don't want to try to plan too far ahead because things haven't achieved stability in any shape or form. So we'd rather do something that's a bit more short and sharp and focused and then reassess. We kind of need to keep a bit more flexible at this stage. So 5 years felt like a really long time. The other thing is that it now doesn't cover the same breadth as the previous frameworks. So it is deliberately focused. And it's deliberately focused for a few reasons. Number one, there's other policies in play that you'll see, and we don't want to just duplicate things. But number two, we are in a time of resource constraints, and I don't have to tell you guys that, but it's just so that you know we know that too. And therefore, we could put out a strategy that says do everything, and there isn't the resource to do it. And that doesn't feel, to me, like the right thing to do. I think we need to be honest about what we can do with what we have and try to get the best bang for our buck, if you like, and be realistic about that. So it's focused specifically. Doesn't mean everything else goes by the wayside. It means that certain things are prioritised. And because it's focused, then the outcomes have had to change. So anybody who knew the previous framework, who remembered the 5 really broad, high-level outcomes, will be really disappointed to know that having just learned them all off by heart, that's not necessarily what's going to be going forwards. Now, they still all really matter, but we're going to have different deliverables, different KPIs, because this is a different beast with a different focus. So just getting to the meat of the matter, what's actually going to be in this strategy, 2023 to 26? So there's going to be 4 fundamental systemic issues, that's the first thing to say, that are going to be given priority. And it's because they are underpinning everything pretty much that we do. And they've been highlighted by a multi-stakeholder steering group as being the most important things going forwards to allow stability and rebuilding better within the sector. The first of those is governance and accountability. And you might take that as a given. You might say, well, governance and accountability should just be there already within the boards, within their services and all the rest of it. And you're right. But again, being realistic and honest, governance is perhaps not all it could be in sexual health and BBV services. Perhaps there hasn't been as much championing or ownership of them as there could be. There's also a need to bring back our national governance structure, if you like. So there is going to be an overarching implementation structure for this strategy, which is going to hold all of us to account for delivering it. And that may well go up as high as ministerial level. So those of you, again, who remember the dim and distant past of INCHBAC, which was the National Sexual Health and Bloodborne Virus Advisory Committee, which was chaired by the Minister for Public Health, we're talking about bringing INCHBAC back. It's like Backstreet's back, isn't it, for those of you who are old enough to remember that as well? INCHBAC's back. Because that ministerial focus will really help to make sure that we deliver on what it is that we're committing to. So there's that level of governance and accountability. The other thing that may be coming back is the board visits in a constructive way to help people be able to move things forward in their own areas and in their own services. And that's because the boards have actually asked us. It's not that we want to go out and and just sort of have a jolly around the boards and or give them a hard time. The boards have asked us to come and said, we really need you to help us focus this at the highest executive level. So they will probably be coming back. And the purpose of that governance and accountability is not just to create more groups or more executives. It's to provide equity of services across the whole of Scotland for our population. So The second fundamental topic is data. And you'll know that a lot of data provision was sidelined over COVID when it comes to sexual health and BBVs, because everyone was diverted into COVID data. So we're going to re-establish that again. We know as well that there are data gaps when it comes to sexual health and BBVs, and there are new things that we are going to be monitoring. So data is going to be a fundamental topic in the new strategy. And the final fundamental topic, if you like, is access and widening access to services. And that's going to look, we hope, very different by providing services where people want them to be primarily. Now, the final fundamental topic that I just want to let you know about is that we're championing the concept of sexual well-being. So we're no longer going to talk about sexual health. We're going to talk about sexual well-being, because sexual well-being is not just about not having an STI and not getting pregnant when you don't want to. It's much broader than that. It's about good sexual relations. It's about feeling good about your sexuality. It's about, if you choose not to have sexual relations, feeling good about that. It's about the whole holistic concept of someone as a sexual being, however they want to describe themselves, and feeling good about that part of themselves. And so this is pretty big. It's holistic. It's really important. We don't kid ourselves that this is going to be an easy task, because we're not the only ones, again, who have skin in the game here. Sexual well-being goes way beyond STIs and BBVs. It goes towards mental health, justice, education, upbringing, culture, all sorts of things. So there's going to be lots of stakeholders that we're going to have to bring along with us for this. So this is the start of a journey. And what we're planning to do is to introduce this concept in the new strategy, to try to come to an agreement about a definition, to try to get some key indicators that we can actually start to measure sexual well-being. And there's a lot of academic literature on this, so thankfully we're not starting from scratch. But we plan to then, over the course of the strategy, produce some baseline data for Scotland to say, what is our sexual well-being like across our population? And how can we make it better? Where are the gaps where people are really struggling in terms of good sexual well-being and feeling good about that part of their lives? So I actually, again, feel really strongly about this. And it's not just going to be a nebulous concept, because I'm afraid I'm a data geek as well. So we are actually going to want to measure it. So just to quickly zip on, as well as those 4 fundamentals, there's 3 key topics that are going to be priority service areas in the strategy. Now, before everyone jumps up and down, this doesn't mean everything else is forgotten. And just because I haven't put drug users on there doesn't mean that that isn't, a really important cohort that will have mentions elsewhere in the strategy. But we're, again, focusing down on young people because attendance has dropped off at sexual health services. And this was prior to COVID. They're just not coming. They're not engaging, and the question is why. And we need to understand better with young people. We're going to have a focus group with young people to try to understand what it is that we're not doing right to reach them. Also, because of COVID, with lockdown and schools being closed, then sexual education and relationship education, and in fact, social interactions for young people had a really big hiatus, and we don't know what the impact of that is going to be on the sexual well-being of young people. So that's why they're our focus. Testing and infection rates goes hand in hand with access. We've got to get our infection rates down. Has anybody seen the recent gonorrhea publication? Horrifying increases in gonorrhea, absolutely staggering hundreds of % rises. So we've got to get our testing up. That may involve a national online testing system for sexual health and BBVs, and testing in other places. And of course, contraception's always going to be in there, particularly LARC, because the other thing is our LARC waiting times, again, have gone through the roof. So those are our kind of priority topic areas. Now, this is a thorny issue. Funding. You've heard me talk about resource constraints, and I wish that, well, I don't wish I had the budget. I was about to say I wish I had the budget, but I don't. But there are resource constraints, and so funding is different. It used to be that we gave money to third sector organisations separately. We now can't really do that. We need to, again, box a bit more cleverly. So what we're doing with this strategy funding is that there's a pot of money that basically everybody, boards, third sector, academia, can all apply for, either individually or jointly. And the idea is that this encourages collaboration, and it encourages efficiency, basically, and people coming together to provide the best possible outcome for the patients for the funding that we do have. We have the bids in already, and I think it's safe to say that we've received a large number, and they're being assessed as we speak. There are a lot of bids. There's a panel, a multidisciplinary panel, who will be looking at those and making decisions as soon as we possibly can over the next few weeks, I would say. So again, just to give you a rough timescale for that, but don't hold me to it, because I'm not the only person on the panel. So just to finish briefly by talking about a little bit about the other players in the game, if you like, so the other policies that are sharing the road with us. Now, I'm not going to speak about hep C elimination, not because it doesn't matter, but simply because other people are coming along next who are far better qualified to speak to that. But the hep C elimination plan you will know about just as well as I will, and has been in train now for quite some number of years and is doing tremendously, but there's more to be done on that. But what I am going to do is just briefly mention the Women's Health Plan, because this is another big government initiative, and it does have relevance to sexual health and BBVs. So even if you don't see something within the sexual health and BBV framework for 2023-26, some of it's in the Women's Health Plan. This was published in 2021. For those of you that aren't familiar with it, it's got 66 actions in it to improve women's health across the entire life course. So it goes from childhood to adolescence to adulthood to older age. And it certainly doesn't just do reproductive health, although quite a lot of it is. It also concentrates, for example, on heart health, because cardiovascular disease is one of the biggest killers of women, sadly, my age and older. So it takes an entire life course approach to it. That's the 6 priority areas for the first iteration of the report. You can see quite a few of them are reproductive health related, including abortion, contraception, menstrual health, postnatal contraception, but cardiovascular is in there as well. These are the ones that relate to sexual health and BBVs. Again, just so that you know what happens to be in there, you can see it's got better models of care, holistic and outreach for sexual health and contraception, increased availability of LARC. So again, you can see the correlation here. Postnatal contraception is in there, and widening the provision of sexual health care and BBV health care, so much more close to home in community settings as best we can. So I'm just going to finish by briefly mentioning the HIV transmission elimination proposal. Again, I'm hoping that this is not new to most of you, but this is another piece of work that's in progress. And this, in fact, was commissioned as far back as 2020. 2020, every time I say that, I get a slight shiver down my spine when I think of what happened in 2020. But it was the Minister for Public Health then who asked Public Health Scotland to deliver a proposal on how we might eliminate HIV transmission in Scotland. So not under-ambitious in any shape or form, and eliminate it by 2030, apart from anything else, which is frighteningly close. And an HIV transmission oversight group, aptly named HITIOG, or HEGIHOG, as it became known because no one could remember it was called HITIOG, was formed in 2022 and chaired very ably by Professor Raknandwani from Glasgow, and brought together clinicians, other service colleagues, academia, Public Health Scotland, third sector partners, and people with lived experience of HIV to come up with a proposal as to how we could eliminate HIV transmission in Scotland. And this is world leading in terms of its ambition. Now, the proposal has 22 recommendations, so at least it's shorter deliberately than the Women's Health Plan. And those are going across the whole spectrum of HIV prevention and care, from testing to PrEP to HIV treatment, and also to reducing stigma. So again, worth a look at that at some point just to see what those recommendations are. So where are we now with that particular transmission elimination proposal? Just to say that one of the big recommendations in that was to form an elimination implementation group. So a group that will drive forward these recommendations. So that is in the process of being formed. We've had one meeting so far. It was actually a scoping meeting just to look at who we thought the key stakeholders would be for this and to try to agree a governance structure. Again, very much like the sexual health and BBV strategy. So they're liable to dovetail in terms of their governance structures and come together so that there isn't too much duplication. But doing parallel and interwoven but slightly different things, one working on the proposal recommendations, one working on the strategy recommendations. So more to come on that, and I guess to say PrEP will be key in that. And if you haven't already seen, the Minister for Public Health just in December announced that we are funding an e-PrEP pilot, which we are hoping will eventually be rolled out across Scotland to allow electronic or remote access to PrEP. So again, just increasing PrEP as much as we possibly can. It won't work for everyone, but it's one of the things that we're taking forward. So just to finish, to say there is a lot going on. As you can see, I can't give you an awful lot of detail on things. I'm just trying to give you a picture across the whole landscape. But policy is power, and we are so committed in Scotland. We're very fortunate. We have that ministerial commitment. We have that senior clinical and senior policy commitment to building on the work that we've done before for sexual health and bloodborne viruses. And we remain committed. You can see by the strategies that we have that that commitment is there. We're putting it down on paper. But we have to all together recognise the environment in which we're operating now with the resource constraints, the need to do it once and do it well, the need to do things if we can and once for Scotland, and the need to prioritise and to work together, more importantly. You know, we just can't have barriers in our provision anymore. So lots more to come and soon. And just to say, I'm really looking forward to working with you all going forward, and I'll happily take, even if I can't answer them, any questions. Thank you all very much for listening.